This information on emotional resilience during this crisis of coronavirus or COVID 19 in March of 2020 is brought to you by the Mississippi Public Health Institute, the Mississippi Behavioral Health Learning Network, the Mississippi Department of Mental Health. The information gathered is from the years of therapy that the speaker has been involved with clients from 3 to 80 years old. The information is also gathered from Dr. Jelena Kikmanovic, who is a psychologist who has written an article on wellness perspective. Chaos is abundant these days. Be sure you're not adding anxiety to your chaos. Much like devastating hurricanes, tornadoes, earthquakes, shootings, and other media-focused crises, watching or listening to the information over and over is detrimental to one's mental state. This becomes information overload, possibly increasing your anxiety and could bring on depression. Although this is situational, the more out of balance you get and the longer you're out of balance, the more likely you are to develop a long-term state of discord and will possibly need therapy, medication, or both. Update yourself on what's going on with this virus, but limit the number of times per day and amount of time you spend getting your update. Protect your children from the repetition of the media giving the information over and over. Your children cannot process that information is the same as it was yesterday. It is often new to them. While we may laugh at this cartoon, it is very, very true. We all have an off button. Everything in our life has an off button. That at this time is what you can control. Stop and think. What is going on with my body, my emotions? And remember that no one has ever calmed down when told to calm down. They may look calm on the outside, but their insides continue to churn. If you feel you're being overcome by anxiety, try taking 3 deep breaths, in through your nose and out through your mouth. Try counting, whether you're counting fingers, toes, chairs, children, count. This will distract you from what is going on in your brain that may be leading you to having some anxiety. Thinking about positive things in your past, things that were pleasant, soothing, and satisfying. Think of things right now that are positive, pleasant, and soothing, and satisfying. Think of things that you might want in the future that you hope are positive, pleasant, and satisfying. Many of us right now may be talking to ourselves. We may be running a dialogue, but if you stop and think, what is my dialogue? Is my dialogue positive or negative? Turn your dialogue of talking to yourself into positive. If you have difficulty moving from a negative dialogue to a positive dialogue, for every negative dialogue you have, try replacing it with 3 positive thoughts. It is okay to have negative emotions. Accept those emotions, but don't let those emotions take over your thought process. Notice the emotions, thoughts, and physical reactions of your body. Educate your children to notice what is going on with themselves. Now is a good time to strengthen a child's emotional regulation. Deep breathing, which we discussed earlier. Many of us now view this as a part of mindfulness, which is a good technique to calm yourself and remind yourself of what you are in control of at this moment. Engage in productive activities. Taking care of things you can't take care of when you're working, taking care of children, elderly parents, because you just don't have the time to fully engage in those tasks. While we are not being sent on vacation from our jobs, We can use this time away from our job to take care of things, start new routines, and reinvent self-care. Human beings crave contact, whether you're an introvert or an extrovert. We like to have socialization at the level we are comfortable with. Use your audio and video technology to your advantage and to stay in touch with others. Social connectedness should not cease during a time such as we are living through. We will live through this and we will move forward. Use this crisis as an opportunity to slow down and reflect. Quiet down your life and ponder what your priorities are. What truly matters to you? Where are you finding purpose and transcendence? The experience of stress and negative emotions can have positive consequences. While we are functioning in crisis mode today, when we journey through this, we can emerge with a stronger sense of psychological resilience, kindled relationships, and a renewed appreciation of our normal life. We can all grow from this transformative experience. We have had the Serenity Prayer as a tool since the 1950s. It has helped millions of people overcome numerous obstacles. Repeating this can help you. Learning this can help you. This is something you can take with you way past this coronavirus outbreak. Learn to control what you can control in a healthy manner. Learn to let go of what you cannot change. God, grant me the serenity to accept the things I cannot change, the courage to change the things I can, and the wisdom to know the difference. Should you find this crisis is overwhelming and interfering with your activities of daily living, please email me at mhale@msphi.org or email Jessica Thomas at jthomas@msphi.org. Either of one of us can help you, as we are licensed professional counselors, but we can also find help for you.